Hi, I'm Dr. Sally Foote. I'm a veterinarian with more than 30 years of general practice experience, and I'm also certified in animal behavior. I provide online education for clients as well as veterinary staff, shelter staff in behavior, especially with a focus on less stressful handling and intervention plans to help reduce behavior problems in our pets. So today I'm going to talk about the 4 to 12-month-old puppy that is going into any kind of tail biting, flank sucking, like really grabbing at the end of their tail, grabbing at their side and spinning around and just, really kind of attacking it. I had a case just the other night, a consult case with a young German Shepherd dog under 1 year of age. And the next day, a veterinarian from Iowa, where I was recently speaking at the Iowa State Veterinary Medical Association conference about behavior, etc., emailed me about a German Shepherd Pointer puppy who was grabbing his tail and biting it aggressively. This puppy was doing it in the veterinary exam room after the exam, so the veterinarian witnessed it. And so I wanted to go over why would a puppy this young go into this kind of an intense behavior of basically self-mutilation or almost self-mutilation. They may not be biting so hard to actually tear their skin, but they are really, going after it and staying focused on the spinning, biting, grabbing and holding on, maybe salivating. And this may go on for 3, 4, 5 minutes at a time, and that's a long time. We're not talking about just sort of chase the tail and play. No, something that's getting much more advanced. So first of all, many behaviors that like tail spinning or spinning, being hyper-focused on a spot, chronic digging, these tend to be compulsive behaviors, and compulsive behaviors are a repetitive behavior that is not like functional. It's not really serving any purpose. It may have initially had a purpose, like a dog digging at a fence to get after a squirrel, maybe trying to get under the fence. But even once barriers have been put in place, the dog is still digging, but digging for like 5 minutes without stop. And maybe a dog chased his tail because, I see the white spot on my tail and I want to move around and do something. But now instead of just that 1 or 2 spin, grab the tail, okay, I'm done. It's not like that. They're continuing to go after, and they do not stop. It can be difficult to interrupt them. And again, they may be actually biting on it and actually sometimes even causing some self-mutilation. So what would be triggering this behavior? What would be the stimulus for this behavior? In an animal, when there has been chronic anxiety, chronic frustration, they're not able to get out and seek, they do not have an outlet for their energy, they lack enrichment in their environment, we oftentimes see these compulsive behaviors develop. Yet it takes a while for anxiety to be so chronic and to build up so much for a compulsive behavior to develop. Typically, you're going to have more avoidance behaviors, lack of exploring behaviors, etc., in the young puppy. And so typically, if it is not due to any other medical or physical factor, if it is strictly about lack of enrichment in the environment, most of these dogs, when they're developing these compulsive behaviors, are over 1 year of age. They've had at least 8, 9 months of this chronic anxiety from when they've entered into their fear period, and they've been living life basically without a whole lot going on for them. You may see these behaviors in dogs that have been raised in puppy mills or in shelters, that have been in shelters for over a year. At least 1 year of age. In my experience, more often they are at least 2 years of age. They've had 2 years of this chronic anxiety before it truly is into some kind of a self-mutilation, intense repetition behavior. So here I had 2 cases. The Shepherd, had started when he was 4 months old. He was older now. He presented to me here at about 11, 12 months of age, but his problem started at 4 months of age, and they've been seeking other, help, trying to help this Shepherd out, and they came to me. And the case from the Iowa veterinarian, it was in a 4-month-old puppy. So good for her. She saw it early. She got some medication started, wanted to know if that was the right place to start, recommended the consult because we got to nip this in the bud, But why would a 4-month-old puppy already be spinning around like this? He's too young to have had chronic anxiety. So oftentimes, the first thing I'm going to think about is there's something physical, something physical going on in this puppy that has this puppy now attracted to or focused on that end of the tail or the side, the flank, the side of the body. So they're too young for the OCD, so we're always going to think of both a physical problem, but then there is a behavioral component. Oftentimes they do lack, enrichment in their environment. I'm going to just turn this a little bit so you can see the rest of the screen better. Okay, or the blackboard, that is. So physical and behavioral. Well, I'll address the behavioral here in a minute, but oftentimes we are not thinking about what could be physically going on with this puppy. First place I think about are parasites. Many of our puppies are dewormed with pyrantel pamoate. Pyrantel pamoate is a very safe dewormer, but it only deworms, it only kills hookworm and roundworm. And we are seeing resistant hookworms now, that the pyrantel pamoate is not killing off those parasites at 100%. So even if the puppy's been wormed every 2 weeks, starting at 4 or 6 weeks of age with pyrantel pamoate, it may possibly still be missing some of the roundworm and the hookworms. Now there's what's called a pre-patent period before tapeworm and whipworm emerge. The pre-patent period means the point where the puppy has been exposed to the whipworm or the tapeworm. So the whipworm, it's out in the soil. When they're getting out and starting to wander in the grass with mom, and they're defecating, urinating, sniffing, licking their paws, whatever, eating some grass out in the dirt, that puppies may pick up whipworms at about 4 weeks of age. But whipworm is going to take about 3 months before it emerges. It breaks through the intestinal wall. It has to go through some maturing stages in the body, and it breaks through the intestinal wall. And when it breaks through that intestinal wall, it can cause very severe pain and inflammation in the bowels. And where it causes that pain in the bowels is at the lower colon. It's where the small intestine joins the colon by what's called the cecum. This is like the appendix in a human. So just like when a human gets an appendicitis attack, the appendix is inflamed, it's extremely painful. The human may be vomiting, they may be doubled over in pain. And yes, there are people who have had appendix problems that maybe were bad one day and better the next. So maybe they just look kind of like, oh, I don't want to move, So we can see the same in our dog. So if a puppy was exposed to whipworm at 4 weeks of age, we're not going to see any kind of physical symptom until they're at least 4 months of age. Now, whipworms also can be difficult to find in a fecal flotation. These eggs are heavier, they don't float to the surface in the solutions we use for a regular fecal test analysis where we're putting a flotation and we're looking for the eggs under the microscope. And even in centrifugation or using a heavier sugar syrup, we will tend to find more of the whipworms, but whipworms are not released every day into the stool in a patient that has whipworms. So you might take a bowel movement on Monday, and that was the day they weren't expressing any eggs, showing any eggs, and it will come out, no ovacine. Really, the accurate way to report a stool test where you don't see eggs is say no ovacine. It really should not be reported as negative because there could be parasites, but you're just not able to see the eggs. Anyway, so no ovacine. So you really need to do like serial stools like every day for 3 to 5 days to see if there might be whipworms. Now there is an antigen test. This is a more sophisticated test that can be mailed off to test for the parasites, which tends to be a bit more accurate because then they're looking for like the protein that's in the stool from the worms that are in the body. So that can be a more accurate way to test for the whipworms. But even those tests are not 100% always finding parasites, even when parasites are present. So when I have a puppy who starts really focusing on the tail, focusing on the anus, seems really like licking a lot or any kind of spinning a lot, chewing at the tail a lot, I'm going to deworm with a broad spectrum dewormer, not pyrantel pamoate. I'm going to go to something like Drontal Plus that combines for it's fenbendazole with the praziquantel, because tapes also are going to start to emerge. Their pre-patent period is approximately 4 months, sometimes 6 months. And the tapes are right there at the end of the anus. They're carried by the flea or by small vermin. So if this puppy was born of a mother who had a bunch of fleas, that puppy's getting bitten on the first day of life. And that puppy may get exposed to fleas or tapeworms the first week of its life. So by 4 to 6 months of age, those tapeworms are emerging in the puppy, and again, can create a lot of anal discomfort, at the end of the tail discomfort, and you will not always see the tapeworm segment in the stool. because you have to see the fresh stool and the tapeworm segment's going to crawl off and be down in the grass. You may or may not see the dried segments around the base of the tail caught on the hair. If the dog is licking a lot, he's going to lick them off. And again, every day, tapeworm segments are not released. There could be days where there's no release, and other days there's a whole bunch of release. So I'm going to use a product that worms for whips, tapes, hooks, and rounds. Okay? And I'm going to repeat it again in 3 weeks, and I'm going to repeat it again in 3 months, because whipworms are extremely difficult to get rid of in the body. You have to do a 3-part or 3-time deworming to get rid of the whipworms, and keep them on the heartworm preventative that prevents whipworms. And that's going to be the Interceptor Plus Sentinel product. HeartGuard does not prevent whipworms. Okay, so you need to talk to your veterinarian about, if we suspect whipworms, that we're using then a heartworm preventative that also protects from whipworms, because the soil has it in there, and whipworms are the most difficult parasite to get rid of in the soil. The Midwest, where I'm here in Illinois, like Indiana, Illinois, Iowa, Missouri, this belt has actually proportionately more whipworms. If you look in the CAPC Council for regionally in the United States, what proportion of parasites are we seeing in pets, comparing these big four, whipworms tend to lead in the Midwest. And the thought is because we used to have a lot of pig farms. And these pigs would be allowed to graze out in the cornfields, which is really kind of nice for the pigs. But a lot of soil has been contaminated with these whipworms. And then, of course, there's housing developments now where there used to be farms. So the backyard, people, oh, my dog's just in the backyard. Yeah, your backyard may have a lot of stuff in it, a lot of hook or whip around that you don't realize. Okay, so parasites. Make sure that we have used different dewormers. We're rotating dewormers. And we're using broad spectrum dewormers on the correct cycle. You've got to get the second one in at 3 weeks. Don't wait 5 or 6 weeks, because that adult may have emerged. Now you have eggs, recontamination of the soil, and the dog may have recontaminated himself. Okay. Second thing, phantom pain. Now, remember that second puppy I was just contacted about in Iowa? He is a German short-hair pointer. Many of our breeds, I didn't ask, but probably he had a tail dock. His tail was cut. And boxers have a tail cut. Some of these dogs also have, like the Frenchies, English bulldogs, they don't have a tail, right? Their tail did not form normally. And the lack of formation of a tail is actually where the spinal column is not closing normally, but those nerve endings may be exposed into that little few stubs of the tail vertebrae that are actually malformed. So you could see how if a tail dock done by a breeder with something like a rubber band, I'm going to say it, folks, that's how it's done in some of these breeders, and it may be too because we do not have veterinary practices doing tail docking, because we're trying to get away from a lot of this, tail docking and ear cropping, etc. All I'm going to say is, though, if the puppy's had a tail dock, there may be phantom pain at the end of that tail because of where the skin is healing over possibly exposed nerve endings. So this phantom pain, it can just suddenly be like this feeling, like numbness in your fingers, like, ooh, what's that? And the puppy's going after it and the puppy's chewing at it. Or if he bumps his base of his tail on something, he's happy and he's wagging his tail and now he's hitting it on things. So then he triggers phantom pain. So with that, or if he had an injury, if the puppy was grabbed by the tail and pulled, or got it caught in a door, or who knows what, that's where you could have phantom pain. Medications can help this. Yes, you can give gabapentin. Gabapentin is often our first choice medication to reduce phantom pain. A joint supplement may also help as well to help build up kind of that connective tissue, to be a protective coating around the outer part of the tail. If we're really, really suspicious of pain or something, aggravating the base of the tail, taking an x-ray of the puppy, of the whole back end, the hip, all the way going down to the end of the tail. I had another case about 5 years ago also where a young veterinarian contacted me about a 5-month-old German Shepherd puppy that the clients reported. So this is where video is great. You got to get a video of the dog or see if you could see the dog have this happen. So I said, get a video of the dog, see what they're talking about, because she said it's probably compulsive. I said, the puppy is too young. He's only 5 months old. She got the video. We both looked at it. This puppy would be walking across the kitchen floor, suddenly drop and cry. And he was turning around to go after his tail, and he was falling to the left. He was ataxic. She got the x-rays. This puppy had a malformation in his spinal column. He had a birth defect. And it wasn't as evident until his body was getting bigger and then the pinching down on the spinal cord was happening. So doctors out there, take an x-ray, go ahead and say, we got to do some things. Let's not assume it's just like playful puppy. And same thing with trainers too. We say, get a checkup by the vet, let's make these recommendations. Okay, third one, that's what I'm talking about here, is the orthopedic or spinal cord deformity. Remember I just mentioned the Frenchies, the bulldogs, even some of our corgis. Being born without a tail is not just being born without a tail. It's because that spinal column, where it's ending, is not. It's not necessary. It may have times where it's not formed and closed off properly, basically almost like a spina bifida problem. And so because of these exposed nerve endings or shortened up and compressed vertebrae of the very last vertebrae in the lumbar spine and the first few vertebrae of the tail, because even though they have a little corkscrew tail or they don't have a tail, when you take an x-ray, you're going to see some little stubbins of a tail vertebrae in there. And that may now be causing inflammation in the spinal column. Okay, so those are the physical things to think about, okay? I'm going to put on our thinking caps about what medications or supplements or ways to manage it. But then there typically is also that behavioral component. And the behavioral component is often lack of enrichment. These puppies are not getting enough walks. They're not getting enough exercise. They're not getting the ability to sniff, to go out and explore, okay? And lack of exercise is one thing. So increasing their exercise, and the other things for enrichment is change all their food over to a food puzzle. If you think about it, the puppy is using his mouth. He wants to use his mouth for grabbing and seizing and kind of exploring, if you will. So we're going to work on maybe some training, but as far as how we feed the meal, we're going to use food puzzles, and you want to use food puzzles like this. Not the ones with like the spinning plates, because that's not encouraging the puppy to really have to move around, sniff, grab, figure out how to get the food out of this. This is, I think, called the barnacle by Pet Safe. Another one I like a lot is called the twist and treat. It looks like a purple flying saucer is what I call it. But the point is, you're going to stuff the food nuggets, and I don't know if you can see it here on the camera, but there's like little flanges in here that really make it harder for the food to fall out. And that's the point. We want this puppy working hard at this. We want this puppy bouncing this down the stairs, flipping it over, picking it up, pushing on it, munching on it to get the food out. And that is going to be the outlet then for this puppy for using his mouth and chewing on things to displace that behavior from off of their own body and onto the food puzzle as part of behavior modification. Now, there may be a whole lot of other things going on that's the increasing anxiety for this puppy. There may be other dogs in the home with resource guarding or housemate competition. There may be some owner conflict. Maybe there's been punishment used or aversives for training the puppy. There could be noise phobia. There could be a whole host of other things. But at the very basics, if you have a puppy between 4 to 12 months of age doing intense tail spinning, be sure that you get a video of the tail spinning to show the veterinarian. Veterinarians out there, I want you to think of, we're going to do a broad spectrum deworming and get you on schedule with a 1 week, 3 week, and 3 months, no matter what. Okay, just clean that gut out. It does so much good for the puppies. Really think about or examine for the possibility of any kind of phantom pain coming from a tail dock injury or the anatomy of this dog. And thirdly, could there also x-ray for any kind of orthopedic problem like emerging hip dysplasia, cauda equina, or spinal deformity in this dog. And from that, then you can work out what the management plan is and or look at what the welfare of this dog is going to be. Can we really improve it or not? Thank you so much for your time. I really appreciate your time here and appreciate your comments. I will be uploading this to my YouTube channel, so subscribe to my YouTube channel, which is Dr. Sally J. Foote. I have over 170 videos on my channel showing handling as well as, some ways to use behavior modification easily in the home, and all these Facebook Lives I've been doing for the past year and a half. I'm also uploading on the channel. If you have any topics you would like me to discuss, please put those down in the comments, and I'll go ahead and talk about those. So thank you so much, and have a great afternoon. Bye-bye.